Victoria has become the first state to introduce a mental health levy taxing big business to support the struggling system. It was a key recommendation out of a royal commission. Former Australian of the Year and mental health advocate Pat McGorry was a champion of the levy, describing it as vindication. I spoke with him earlier.
I guess the way it's financed to me as a mental health professional and worker working in the field is up to the politicians and the government. But what's really good is that the government has committed a very substantial first tranche of funding to implement the findings of the Royal Commission, and that's going to make a very big difference to the lives of Victorians with mental illness. It'll take time because we've got workforce issues, but the money is starting to flow, which is the first time I've seen that in probably 2 decades.
And we have seen, even in just recent weeks, the government announcing extra funding to help get more staff. I believe it was 350 workers announced in the last few weeks alone. How satisfied are you with the way that the government has responded to the findings from the Royal Commission?
I'm very satisfied. I've seen not a single step backwards from any of the recommendations. The government's fully committed at all levels, I think. The problem is execution in the middle of a pandemic when there's a rising tide of new demand on top of what was there before, and an exhausted workforce and a short supply of reinforcements. Those are the major problems, not the government's leadership or commitment or funding, but actually the execution of the reform now, and that needs very creative and innovative and determined solutions, just like we've applied to the pandemic itself.
Are there any areas you think the government needs to be showing more attention to?
I think, it's a little bit difficult in the middle of Omicron, but as that settles, which, the indications seem to be pretty positive at the moment, as that settles, we've got to start shifting workforces around and retraining, pretty quickly to meet what we call the shadow pandemic, which has had 4 times the effect of COVID, believe it or not. We've measured the negative effect on the health of Australians from a mental health point of view as a result of the pandemic, and it's 4 times as impactful as COVID. If you look at the new cases, the suffering, the functional impairment and disability that's arisen, and the fact that the whole population has been affected in a mental health sense. It's a very big issue, mental health now, and we've got to treat it as the shadow pandemic, as the main pandemic does abate, as I think it will in the coming weeks and months.
Pat McGorry, on the COVID pandemic, how damaging is each new variant in terms of the toll that it does take on the mental health of Australians?
Well, it depends on the variant, doesn't it? The indications of this one are that it's more transmissible, so a lot more cases, but the severity of it is quite clearly less now. And I think one of the problems, apart from the sort of realistic fears that people have, is the fact that if we exaggerate the risk, if some people seem to be exaggerating and highlighting the risk before they really know, that has a undermining effect on people's morale. And I think trying to find the balance, the middle path here, and you have a whole range of expert opinions, from almost denial of the severity to exaggeration of the severity, and I think trying to find that middle path and reassure people, give them hope and optimism that we're going to get through this. Not a blind optimism, but a realistic optimism is very, very important for the mental health of Australians. I think Australians are really exhausted in a mental sense from this pandemic, and we need to be projecting a sense of confidence and self-belief based on our ability to deal with it. And also then we need to provide that support and mental health care for those who have really sort of reached their breaking point, which many, many people have.
Yeah, no, it certainly has been an exhausting, draining couple of years. We are now in 2022. Before I let you go, do you have any New Year's resolutions?
I think just the same as usual, just, basically trying to be positive, trying to find solutions, trying to do our very best to meet, the mental health needs of Australians, especially the young people, because the young people have borne the brunt of this pandemic from a mental health point of view. and work with them and their families to produce a much better mental health system with the support of our leaders, who I think are really starting to understand the importance of mental illness and mental health for the strength of society, especially here in Victoria, as we started off talking about.
Pat McGorry, thanks very much for your time today. Happy New Year.